And we are here today to talk about behavioral health, a provider survey that you all should have received. And if you haven't, again, please write it in the chat or send us an email. You'll see our email throughout the training today. So please send us an email and we'll send the survey your way. So we are working with the Department of Health to embark upon a rate study for behavioral health services, and the specific services, again, we'll talk about momentarily. So your participation in this survey will be really key for us to use as an input in those rates to make sure that the rates that we're calculating are addressing the cost to you all of providing services. So we are really looking forward to talking about the survey. I know it is bulky and big, but we are going to walk you through the whole thing. And we are also recording this meeting. You'll see a note come up on your screen that a recording has started. So we are recording this so that way, if you or any other providers who are not able to attend today want to refer back to the training, you'll be able to do so, especially as you're filling it out. If there's something you have a question about, of course, you can always reach out to us, but you can also rewatch this training. So with that, I will turn it over to my colleague, Chris, to get us started.
Thanks, Liz. Hi, everyone. I'm Chris Korsick. I'm a senior consultant here on the Guidehouse side. I'll be walking you through the deck, and I'll be walking you through the actual Excel file survey where we're kind of getting to the details of the survey itself and allow you guys to ask some questions at the end on the survey. So let's get started. So our agenda is just a general overview of the survey and the rate study as a whole, and then we'll step into the actual Excel model, go through the survey. And then after that, we'll talk next steps about training and technical assistance, and then next steps for the survey itself, and then time for questions at the end. So to start off, if you have any questions throughout this presentation, please feel free to use the chat function. Steps 1 through 3 are there. If you are unfamiliar with how to use the chat function on Teams, you just click the chat button. A box will appear. You type in your question and you hit enter. Or if you would like to vocalize your question, you can go ahead and use the raise hand function to be unmuted, and you can ask your question as we start presenting. Also note, if you have any technical difficulties throughout the presentation, or for some reason if you can't hear me as I'm talking, feel free to use that chat function as well and let us know. And also if you have some technical difficulties where you're having trouble hearing stuff, like Liz mentioned, this presentation is recorded, so there's always an opportunity to go back and review things that you may have missed. So rate study overview and why we're here.
Sorry,
and kind of where
Chris.
Oh.
Sorry. Before we jump in, we will be answering questions mostly at the end, but feel free to write your chat in the box or raise your hand so we can get those questions. We'll be keeping track of them. Just so you know, if you do ask a question and it's not immediately answered, we're not ignoring you. Sorry, Chris, go ahead.
No, that's a good comment. Thank you. So the rate study overview and why we're here. Liz kind of touched on this, but the Department of Health is conducting a rate study to evaluate the reasonable and necessary costs incurred by providers to serve behavioral health participants. And the Department of Health is contracted with us here at Guidehouse to provide recommendations and considerations for the behavioral health rate study across the behavioral health service array. DOH as well has constructed a rate study work group of stakeholders who are subject matter experts and offer advice and input throughout the rate study. We've worked with the Department of Health as well as this provider work group to create this survey to make sure to ask Alaska-specific service delivery questions and make sure that we're just gathering the necessary information that's Alaska-specific. And lastly, that bottom right box is what we're doing today, walking through the survey as part of a training. So we'll get into that momentarily. So rate study timeline, kind of just showing you a very high level overview of the entire rate study as a whole. So far, right now in the fall of 2024, we've conducted background research, looking at things like peer state comparisons to your guys' current rates. We've established that stakeholder work group, and then we developed and released this past Monday, and then we'll eventually analyze all of the surveys that you guys fill out here in the fall. Moving on from the release of the survey and that survey analysis, we'll do some additional analysis and then finalize our rate recommendations in the winter of 2024 and 2025. And then following those rate recommendations, so the post-rate study steps, we'll seek budgetary approval and then other possible implementation activities in spring of 2025. So moving on to this rate study and the services that are included in this rate study are shown on the screen. They're all the 1115 waiver substance use disorder services, as well as the behavioral health provider services, as well as the state plan community behavioral health services. Some of these are bucketed too, such as like the ASAM services 1 through 4, but just a high level overview of the types of services that are included in this survey. It's everything from residential services to basic psychotherapy services to case management. So moving on from there, the survey design and topics. I won't spend too much time on this slide, but this just provides a high-level overview of the information that we're collecting in the survey. So within the overview tab are general instructions, things like the color coding throughout the survey that will be beneficial to you guys, as well as just sub descriptions of the tabs and schedules within the survey itself. We collect you guys' provider information, collect things like total costs and expenses for delivering services, collect information around your employees' wages and benefits. And then finally, we get into some of the service delivery and staffing patterns for your services in specific. So from there, I'll stop sharing my screen and actually hop into the survey itself in Excel. I'll put on my other screen because I get in some trouble sharing that one. There we go. Perfect. All right. So now we're in the actual Excel survey itself that you guys probably had a chance to take a look at. Right now, we're on that first tab, which is the overview tab. Like I mentioned, this tab just provides some general instructions up top of what to expect in the survey and the type of information that we're requesting, as well as some key things to focus on within the survey. When you first open it up, we recommend saving the survey to your personal desktop or just somewhere on your personal computer, because sometimes there's a little bit of nuance just with opening a Excel file straight from an email. They can have some potential issues, so we just recommend saving it to your personal computer. As well as when you first open up the Excel file, we recommend enabling content because there's built-in macros within this Excel file. And if you do not enable the content up here, when you first open the Excel file, it will not allow those macros to work, and you won't be able to see some of the service delivery tabs, which are very important to fill out. Along with this top section, it's also a link to our survey, which we'll talk more about at the end of our presentation. But this survey, this email will be used for you guys to ask any questions, for us to provide any technical assistance, and you'll also use this email to send in your final surveys to us. And section 2 here just goes over the color legend throughout the survey. So anything that is yellow shaded is where we're asking for your guys' input. It's important to fill out those yellow shaded sections where they're applicable. Any blue shaded sections are kind of specify or kind of placeholder sections. If, for example, we have these a lot on like the wages tab where we have different occupations, and within the occupations list, if there's a occupation that your agency uses that's not in that list, you can populate the specify box with that occupation as an example. So that's kind of an example of what the blue specify cells are for. Anything in the gray. Yep.
Will you just zoom in a little bit?
Yeah.
I just assume that if I am having trouble seeing it, other people might be too. Thank you.
Yeah, sometimes I forget I'm on a bigger monitor, so yeah, it's definitely a good call. Anything that is shaded gray is auto-populated and does not need to be filled out. This is a lot of the totals and just calculations throughout the survey. Anything that is shaded orange are examples to kind of show some of the formatting and type of information that we're requesting for that specific area. And then anything in green text references dates. These are usually at the top of each of the tabs to show which date which date timeline you should follow to fill out that section of the survey. And then below here just provides just general overview of some of the service or some of the topics within each of these sections throughout the survey. That's really it on the overview. Just provides some good general instructions and kind of just the color legend throughout the file, and then just some high level overview of what's contained in each of the tabs. So moving on to the provider information tab. Here we're just collecting your guys' personal information about your agency. So the top section is provider identification. So collecting things such as your name, your NPI number, any cities, zip codes, and then your provider fiscal year, beginning and end. This would be your most recent full year that you should be using to fill out certain sections of the survey. Section 2 is contact information. I recognize that there might be several people filling out different sections of the survey. Some might be filling out like the expenses, some might be filling out the service delivery sections. So just the main point of contact for the survey is kind of what we're looking in this portion of the survey here. Section 3 just looks at your different revenue splits across your behavioral health services. So looking at like splits for Medicaid, Medicare grants, and so on. And if there's any other revenue that you receive that's not in this list, go ahead and specify that in this box here and then enter the appropriate amount. And then section 4, this is an important one to note here on this tab because it kind of will impact the rest of the tabs throughout. So the question here is, are you able to provide service-specific transportation information? Meaning, are you able to split out metrics such as like average number of trips per day, average miles per trip per day? Are you able to split out those specific questions and metrics per each individual service? If you are able to do that, you'll toggle this to yes. And then within some of the latest service delivery tabs that we see, you'll be able to fill out the transportation specific service sections. If you cannot split out transportation across each of your individual services, but can do it in aggregate, you will toggle this to no, and that opens up this transportation tab here, where you fill out just those average number of trips, average minutes per trips, and average miles per trip across all of your services. So just to highlight that one again, if you're able to split out transportation related metrics at the individual service level, you'll toggle this to yes, and you'll fill that out later on in those individual service delivery tabs. But if you can't, then you'll toggle this to no. And then the last section here in the provider information section is just provider staffing, just trying to get a total count of your full-time and part-time employees for your most recent fiscal year. So that's it for the first. Yeah, go ahead, Liz.
We do have 2 comments in the chat or questions. So the first is, what if your organization has more than one NPI? So you can enter all of the applicable NPIs in that same cell. But I think if there is a primary, list that one. I know organizations operate differently, where sometimes there's one, sometimes there's multiple. So list all those that you have. And then there's a second question around whether transportation includes vehicles that receive mileage reimbursement for transporting clients. So yes, I believe that would include that type of mileage we do want to track.
Yep. Yeah, I agree. Good questions. That's it for the first section of the provider information tab. The next one here is kind of a part 2 of this provider info tab, but we're just asking for your site specific information. So the different cities that your sites are located in, if you have multiple, the zip codes, and then the total number of Medicaid behavioral health participants, and then just the total behavioral health participants for each of those sites. Moving on now to the total cost tab. If you zoom in a little bit, you can see here that there's 2 columns, one for total expenses and then one for expenses for BH services specifically. We're requesting that you provide all of your expenses within column 1 here. So if you provide any services outside of just behavioral health, that will be listed in here as well. And then in column 2 here, you'll split out just behavioral health allocated costs for BH services. And to note, if you only provide behavioral health services, these 2 columns should be the same. Just wanted to clarify that, those 2 columns. So for the total cost tab, there's 6 different sections. The first section here is requesting information around employee salaries. So this would be direct care employees, direct care supervisors, maintenance staff, administrative employees, and then program support employees. And then 6, 7, and 8 are for contracted direct care, program support, and then administrative staff. And then section 2 is for employee taxes and benefits. So this is in total, just the total payroll taxes, any cost towards health insurance. If there's any other insurance that you provide, such as like vision, dental, or any other insurance that you guys do provide, you provide that information on this row. And then just total other benefits would be entered into question 12 here. Section 3 is related to non-payroll admin costs. This will be anything outside of employee salaries. So things like office equipment, office supplies, advertising and marketing, anything really administrative related that isn't employee salaries will be entered into this section here. And then section 4 is for non-payroll program support expenses. Same thing here, but for program support, just any of the program support expenses like program supplies, and that type of stuff will be entered into this section here. So anything outside of the program support employee expenses. And then section 5 is related to the facility vehicle and equipment related expenses. So we have facility rent, interest, and depreciation up here at the top, as well as the total square footage of the facility. We ask for things like utilities, telephone bill, and as well as vehicle related expenses in this section here. So in all, just really trying to gather your total expenses for delivering all of your services here in the first column, and then services specifically for behavioral health in column 2 here. Were there any questions on the total cost tab before we move on? Awesome. If not, we can move on to the next tab. Next tab here
Sorry,
is the,
Chris, there were a couple. I didn't get off mute fast enough.
all good.
Okay, so one question about for rent, etc. Are you looking for monthly? Is the question, and I think
We'd be
we would
looking
want
for
the
that
annual.
Yep. Go ahead, sorry.
No, you go.
We'd be asking for the annual rent, so just the 12-month total would be entered into line 42 here. So that's the note too. I guess along with that question, all of the costs and expenses reported in this tab will be for that most recent fiscal year that you provide in this provider information tab. So a lot of the other tabs are just the most recent quarter of, or quarter 2 of 2024, but the total cost tab is your most recent fiscal year. So we're trying to capture that full year of expenses, if that makes sense.
Yep. There's a couple of other questions as well. So we have a commenter asking about snow removal costs and where to add that. It's a great question. I'm thinking about, do we have other facility related, like building maintenance and repairs? Seems like it could make sense because that's sort of maintenance to maintain the usage of your building.
Yep, I agree.
That would be my recommendation. Okay. Let's see, we have some other questions too. Is this specific for provider incurred expenses or all program expenses? So I think that this should be really all program expenses that you as a provider are experiencing over the course of your fiscal year. And then we have one more question. This is the last question I'm seeing, which is we have foster care homes that would be considered contractors that we pay a stipend to monthly. Would that qualify for employee salaries? It's not technically a salary. Coy, I'm not sure if you have thoughts on that particular question around how to incorporate foster care stipends. Yeah, Coy, I'll see if you have any thoughts on that.
Yeah, this is always a tricky one. I think we definitely want to know the stipend information. It doesn't fit neatly in many of the categories that we have. But Chris, I believe in the additional information, we have some free form, basically free form sort of tell us anything in addition. That would be a great one to highlight in terms of what, for the foster care homes, what you pay in terms of typical stipends for those. But yeah, that's not necessarily something that you would put in any of the other boxes. Yeah, we don't want to report it as wages. I will be very clear about that, right? Because it doesn't really fit that category. Is likely to skew information that you would otherwise provide around kind of employee or staff types of services. So, Chris, unless you think there's a better place for it, probably the additional information, it needs to be where it is.
Yeah, I think entering it in this additional information tab makes the most sense. I don't think it fits appropriately in these employee salary buckets. So that's a good comment. Just add that cost into the additional information tab, and we can take a look at it from there. Great questions. There's no other ones. We can move on to the programs and services tab.
Yep, nothing else in the chat.
Awesome, thank you. So this tab is very important to look at and to also fill out, because this allows you to fill out the service specific questions around the types of employees that are doing your services, as well as the actual service delivery questions. So we sort of bucketed similar type services. So top one here is all the therapy services, testing, evaluation, screening. We put the autism services together. As you kind of go through this, you'll see just different buckets of service groupings that we've assigned. And if you provide any of these services, so for example, up top here, if you provide just psychotherapy or every single one of these services, you need to toggle this to yes, because then that opens up these service specific tabs. If you don't toggle this to yes, so if you leave it blank or if you toggle it to no, those tabs will not show up. So it's very imperative to go through and filter each of the service groupings that we have if you are providing any of the services to fill out those service specific questions later on. So for the sake of our conversation, I will toggle all of these to yes to open up all the service delivery tabs. So just to highlight again, just make sure you toggle each of these different toggles to yes, no, or leave a blank, whether or not you provide any of the services under each of these groups. So we'll get to those service delivery specific tabs in a second. But for now, we'll move on to the wages tab. Here we're trying to gather your staff types, information around wages, whether or not they're an employee or contractor, looking at things like total wages paid across the year, as well as total hours. So you can see in this top section here, we have the direct care workers, and lines 1 through I think 29. Yep. So this is our predetermined list of occupations based on the services you guys provide. We think that this is an extensive list that can be used, but if there is for whatever reason that an occupation that you guys use for your services that is not in this list, you can go ahead and fill out one of these specified boxes with that occupation. And then same thing with the supervisor staff below here. If any of these occupations do not cover any of the supervisor staff types that you have in your organization, definitely just feel free to fill out these specify boxes. But one thing I want to note is that you can kind of group where you can. So say like if you have a occupation that is titled like a mental health counselor, I think it's safe to bucket it under this general counselor bucket. Just wanted to highlight that just in case there's any questions around that. So I kind of go column by column about the information on this wages tab. So for each of these occupations, for the direct care workers and then also the supervisors, we're looking to see if this is an employee of your organization or if this is a contractor. We're looking for the average, lowest, and highest hourly wages paid for this occupation. We're looking for the annual average percent changes in wages to kind of see how your wages have either increased or maybe even potentially decreased over time. Column 8 here is the total number of FTEs. So just trying to understand how many of each of these occupations or job types you have within your organization. 9 through 12 is the hour related questions. So column 9 here is the total regular hours paid. Column 10 is any overtime hours paid. 11 is around supplemental pay hours, so things like shift differentials. And then column 12 here is just the total across all of those hour buckets. And then similarly here, but for wages, we have the total regular wages paid. We're looking to gather total overtime paid, supplemental pay, and then any bonuses, which would be like those one-time lump sum payments. So stuff outside of supplemental pay. One thing to note here too is we're not looking for averages. We're looking for the total amount. So say if you have 5 different employees, we want the wages combined. We're not looking for an average. We're looking for the total amount of all the wages together. And then column 17 here is staff training. So looking at the average number of annual training hours for each of the staff members. And then 18 and 19 here, we're looking for any full-time or part-time unfilled positions, just to get a sense of if your agency is fully staffed or if you have any open positions available for any of these job types. That's really it on the wages tab. Really just trying to gather the hourly and the hourly base pay, the hours, and the salaries paid across your occupations that you guys staff for both direct care as well as supervisors. Do we have any questions on this tab, Liz?
We do have a couple. So we have one and one person's hand raised on, but I think it was actually on the prior tab on whether level 5 RPTC is not listed. And my understanding is that that is PRTF, which we have separated out of this survey, and it will not be included. There will be some additional discussion around PRTFs, but not as part of this particular survey.
Yeah, that's a good question. I should have noted that when I pull up the services that PRTF is not included in this particular survey. That's a good question.
Okay, so continuing going through the chat, we have a comment in here about how the survey is a point in time estimate and does not include anything where we're seeing decreased coverage in insurance, reduced PTO or other fringe benefits, and possible like elimination of other necessary positions. So the question is there a way to account for what it truly would cost to perform the service with what it means to be competitive in the market as opposed to what is being paid now. So I think that is a really great type of thing to include in the additional information section. If there are positions that your organization has cut or benefits that have been reduced, anything like that, please feel free to enter that. We are going to, I think Chris has mentioned this when we were going through the deck, but we're going to bolster these responses by comparing to peer states and by looking at publicly available data, including data that covers commercial or non-Medicaid payers, so that we can make sure our resulting rate is competitive for you all. And Coy, I'm seeing you on video, so you may have wanted to say something about that.
Yeah, so I'm really just kind of reinforcing what you're saying, Liz. That the call survey is a particular instrument that we're using, and you're right. It's a great question in the sense that it's really only capturing sort of historical costs, but not even like the whole history. It's really kind of reflecting what it's asking you to tell us what your service delivery looks like now and the cost of that service delivery, right? So like if the reimbursement rate is that you currently have is not adequate for some reason, like let's just say, hypothetically, like it's too low, you can only pay people what you have the dollars and the revenue to pay. So just because it's in a cost survey doesn't mean it reflects, what rate adequacy would look like. So we definitely acknowledge that. At the same time, we don't want the cost survey to try to capture everything. Like it's not really asking what would or should be the case under other conditions. But those are so we really are interested in just what is current, what are current costs and current service delivery pieces look like. But as Liz was saying, our methodology encompasses a lot more than that. So this is really sort of one data source, kind of one point for decision making, and we will be comparing kind of especially wages that you guys put in here. We'll be comparing it with other indices, basically just anything we can get to talk about kind of the larger iceberg of where costs are and need to be. So BLS, will be mentioned very frequently, but especially on the benefits package, for example, I think that was cited in the question, right? Like that's an area where there's often a bunch of variability with providers, and that's often you don't have as much flexibility in the kind of wages you pay, but the benefits of those extra costs that you you may have flexibility on, and so those might be a little thinner if reimbursement is lower than you'd like it to be. But one of the I call out benefits because this is one of those areas where we collect a lot of information around what you offer currently, but there's a lot of information out there in terms of what a competitive benefits package looks like, both in terms of cost of healthcare and health insurance, what it would cost to cover dental, vision, all those sorts of things, retirement plans, and whether you're offering it or not today, or whether you're doing low cost health plans that are not necessarily great for employee retention. We'll be looking at kind of what are the industries more broadly, not just healthcare or social services, but what are industries in Alaska more broadly paying for their staff members. And so one of the approaches that we can take, that we'll have the ability to take when we're doing the methodology, is really like what is reasonable for the state to pay for a benefits package that's gonna retain and recruit staff. And so it's not just regurgitating back to you your costs that you report on the cost survey with a little, maybe not necessarily little or big, but an inflation adjustment. So we will be making those sorts of decisions and with additional feedback. So as Liz was pointing out, the additional information it's not just like, hey, it'd be nice to just have some other place where I can report something a little bit like that. If there's an area where you really want to, suggest to us the costs are not reflective that you're reporting, even though these are your costs, that in some areas they're not conveying kind of correctly what you would be paying if you weren't under, certain kind of cost pressures, whether it's benefits or wages or anything else. That could be very, very valuable. And I think, we should have opportunities for some further discussion on kind of where some of these costs need to be in a better fiscal environment or whatever. So I'll kind of stop here in a second because I feel like I'm starting to move into rambling. But I really just want to stress that we're looking at that prescriptive element of what should the cost be, and not just the descriptive element based on what you told us, and we push it forward with an inflation factor. So
So
pass
I'm
it
seeing a
back.
couple of follow-up questions. I'm going to skip around in the chat. I see all of your questions, but going to skip around just based on the topic, and then we'll move back up. So we're getting a question about reviewing the DOJ report versus what you all show as provided services. So we can definitely take a look at any supporting information, especially a DOJ report, to see what kind of gap is reported there. And then a second question around how we account for higher costs of living in Alaska, and what indices we benchmark against for cost of living. So we definitely take a look at a variety of sources here. We use Bureau of Labor Statistics that will be specific to Alaska. We will use as well as peer states, because we do understand that higher cost of living. Chris, you might have a couple others that we're looking at off the top of your head.
Yeah, BLS is a good one for the wages. You can get Alaska specific and compare those to like what you said, the peer states. But around benefits, we have MEPS, which is the Medical Expenditure Panel Survey, which is a really extensive healthcare insurance survey. And that is also Alaska specific. So we can see kind of any variation between the state as a whole against your providers' reported wages and benefits to see how you guys are shaping up against your state as a whole, and then also against any peer states.
Thanks, Chris. A couple of other questions we have in here. So I guess continuing on a similar, well, let me go back up a little bit. So we have a question around the wage. Sorry, I skipped one. We have one around additional costs of maintaining employment, like professional licensing, TB testing, background checks, etc., and where that falls. So I think we have a spot for other kind of supplemental pay. Am I right, Chris?
Yeah.
So that could be something considered like other supplemental pay, but really it seems less like pay and maybe more like some of that stuff would fall under staff training. And in general, some of that is admin cost that could be included on the prior tab under admin. Okay, continuing to go down. The wage worksheet is asking for quarterly data. It says, but the total regular hours paid example is 2,080 or a year. So are the hours supposed to reflect the quarter or the year?
Yeah, that's a good question. I can see how that can be a little bit confusing. For these hourly wages, we're looking for that quarterly, like the most recent full quarter, which is Q2 of 2024. We're looking for that snapshot in time for these hourly wages. But as far as some of the stuff that would be annual, like the regular wages paid, that would be more like annual as opposed to like the quarterly amount. Same with like the FTEs, we're looking for just the total number of FTEs that you have for that most recent quarter as well. Does that sort of answer the question?
Okay. The next question also asks about the quarter. So is it 4/1 through 6/30? I think that would be the case. We are looking for the most recent quarter for each of your providers. We have another question about children's residential services being included, anything higher than level 1 and level 2. Chris, do you want to speak to that?
Yeah, let me pull up the residential services that we have. So these are all of the residential services within the rate study that we have identified. So it looks like AMHR level 1 and 2, ASAM level 3.1 up to 4.0, CRT level 1 to level 2, and then some of these clinically and medically managed detoxification services.
So it would just be children's residential level 1 and 2 to be included here.
Yep.
Okay, continuing down our list. If we have hired in the past year, hired multiple different occupations, but not all at the same time. For instance, sometimes we are able to hire an LCSW, sometimes we have a master's level clinician. So I think you could account that as a partial FTE, just given that the person would not be there for the whole year, so it wouldn't be 1 FTE, but you could accommodate, let's say they were 3/4 of the year, that would be 0.75.
Yep.
Okay, a couple more questions. Health insurance and liability coverages historically are negotiated between now and the end of November for a January 1 implementation, so the costs may not be known until December. So we are asking for a historical quarter, so not what would be effective this coming year, but rather what has already been in place for this prior year. Again, that's the 6/30, or sorry, April 1 through 6/30, June 30th timeframe. Then we got a question about accounting for different costs in rural communities. So that's something we'll definitely plan to take a look at, and something that we'll probably discuss, especially with our stakeholder work group, to understand a little bit more about that. Again, that's something where transportation comes into place quite a bit. And we will definitely be taking a look at some of those differences and discussing the impact of those differences and what that might look like with the rates. And then the last question that's in here for now is how we are accounting for indirect costs. So Chris, do you want to show that? In the total cost tab.
Yeah. So any of the indirect costs, that might be some of your administrative costs that you have, as well as some of this. So basically anything outside of your employee expenses. So under section 3, 4, and 5 looks like.
And I think we asked for administrative employees salaries.
Yeah, it'll
well.
also include wages and compensation for that are payroll related, but we'll classify those as indirect costs.
Okay.
And we don't ask a lot of really detailed questions on the indirect costs. If you do have, please reach out to us if you have kind of concerns that these total costs are not capturing it. But like indirect costs is one of the few places that we try to make lives easier for you, that we really only ask you to report them really kind of in aggregate. Not so in aggregate that it's just like, here are my indirect costs and here's the total dollar amount. We do like to kind of see it in these categories, but we don't ask you to drill down any deeper. So hopefully that's welcome news, that they didn't want to know every aspect of my indirect costs. but it's still a pretty extensive list. But we do have, there's room in here for other on the total cost. So if there's if you have questions about like, I have this indirect cost that doesn't fit in any of these categories, we have a few places where you can put those costs. And if that doesn't even seem right, I'm sure we can work out another solution to get them all represented.
Okay, so I know we've been going through these responses pretty quickly. So if there's anything that still feels unclear or you have questions about, again, feel free to put them in the chat. But in the meantime, we can continue on to the next tab, Chris.
Perfect. Thank you. So the next section here is related to benefits. This is for any full-time and also part-time direct care staff only. So this section will not include any benefits related information for your admin, maintenance, or program support employees. This is for direct care staff only. So the top section asks questions related to health, vision, and dental insurance. Really here, we're just trying to gather how many employees are offered this insurance, whether or not you even offer health, vision, or dental insurance to begin with, how many of these employees take up these benefits, what the contribution amounts are, and just that type of information in regard to health, vision, and dental. The second section is for retirement, asking if your organization contributes to retirement funds for your direct care staff, how many of the direct care staff receive the contributions or take up the retirement benefit, and then what the average retirement contribution is. We also have a section for other benefits. So if your organization gives other benefits outside of health, vision, and dental insurance, and then also retirement, you can specify that here in the blue specify box. Let us know how many employees take up this other benefit and then how much this costs your organization. Section 4 is for unemployment insurance and workers' compensation. It's just looking for that percentage and then the amount for the average workers' compensation cost for your direct care staff. And then section 5 is trying to get at PTO or just time for your direct care staff that's paid. So things like holidays, vacations, sick time, and personal days, just trying to gather the total amount of paid time off that your employees have. So that is it for the benefits section. Were there any questions on this one?
There are no questions, but I will just add just some examples of other benefits that you may have. We've seen gym coverage, we've seen transportation stipends, student loan help. So there's or an education stipend. So different types of benefits that could be included. Just wanted to give a couple of examples there.
Yep, that's definitely really helpful. Thank you.
And we did just get one question about foster parent stipends, because they are providing direct care and are licensed and documented in the health records. Why would foster care stipends be considered? Why would they not be considered contracted direct services cost? Coy, again, this might be a place where I call on you to help answer that.
Yeah, I mean, the issue I think is not that we don't consider them direct service costs, or even contracted costs, but they're not really equivalent to wages. So if the proposal is to include them to list them as contractors in the wage section, I may not be understanding kind of what your thoughts are in terms of where to put those costs, but we would just want to be very clear that this is for the foster parent stipends, because the stipend it's not exactly a wage or even a contract cost, in the sense that the foster parent is still going to be subject to the kind of like say Department of Labor requirements around staffing, right? So that it's a much looser sort of employment arrangement and won't, it won't translate well into when you think about like, 20, 80 hours as an FTE. We don't consider it sort of a staff service. So we just need to be very careful about where we put it. It's not that I totally agree with you that it's a direct service cost. Um, so we just need to be careful about how we handle that. And we're happy to follow up if I gave a sort of a solution at the top of the call when the question was asked. There may be better one than that, so we can identify that those costs a little more clearly for you. But we may just need to follow up with you on how best to treat those.
And Coy, there's a comment that the stipend, at least for one provider, is based on Medicaid revenue. But I think that
Yeah,
still
no,
speaks to what you were
that
saying.
totally makes sense. And when we're thinking about it in terms of when we're thinking about it in terms of the rate setting, it sounds like the stipends like the stipend is based on the overall revenue in terms of what's being offered in the rate. There are things that we will want to think about in terms of, are there other costs beyond the stipend that go into those services? Because in some cases we see, foster care where there's some kind of direct provider services in the form of respite or things like that are more than just the stipend. But we'll need to take a holistic look at that. So it's not surprising to me when you say, well, the stipend's based on Medicaid revenue. We're not really thinking these guys as employees, but they are contracted services. And so we want that information. I just need to think a little bit more about what the best way to get it in the survey, so it doesn't skew our understanding of wages or compensation, even contracted compensation, because it's a little different.
And I'll just add, thanks, Betsy, for the reminder that if there are like specific questions about your circumstance, feel free to shoot us an email. I'm going to put the email address in the chat, and you'll also see it several times throughout the presentation. So I will put that in the chat. Feel free to send us an email. And if there's anything else that we can answer that's specific to your situation, we are happy to do so. Okay, that's it on the chat. So Chris, I'll pass it back to you.
Perfect. Thank you. So now we start to get into the service specific tabs. Each of the individual service groupings, so like these colored tabs, will have a very similar services tab at the beginning where we're looking for you guys to mark. We're trying to understand the staffing for each of your services. So you can see here, there's nothing populated under the staff list, but once you go through and fill out the wages section, based on the occupations that you guys employ, you'll start to see those wages pop up here. And then from there, you just will mark where this occupation is used. So for example, if you have a behavioral health aide who was a part of your group psychotherapy services, you would mark this X. And if these two were not part of the service, you would just leave it blank and so on. You just would indicate which occupation applies to which service and who's like actually delivering the services. So we can just get a better understanding of what type of staff type and occupations you're using for your services to provide direct care. From there, though, we can move on to the therapy service delivery tabs. So these service delivery tabs are service specific, and we really are just trying to get at your staffing patterns and looking at things like billable versus non-billable time. So I'll just go through each section and kind of explain what we're trying to gather here. So the first section is service delivery and staffing patterns. So really what we're trying to do here is understand your billable time versus non-billable time. So when I talk about billable time, this would be time for direct client-facing services. So time in person or via telehealth. So time spent actually delivering the services. And then any time outside of the direct client-facing times, so things like record keeping and documentation, or if you're traveling to and from the service. So basically any time that is spent for the service that isn't directly client-facing would be these sections here below. We're trying to get the total percentage of time spent between these two different buckets between billable versus non-billable here. So in total, each of these should add up to 100%. From there is the staffing pattern section. So we're just trying to understand how your services are staffed. So over here, if you have an individual service, we would expect this to be one-to-one. But really, this is important for group setting services so we can understand on average how large your group sizes are. For the section 3 here, the session service patterns, we're trying to understand how long in hours each service takes. This is particularly important for those services that are billed per session or per visit or per assessment to give us an understanding of how long on average it takes you to do an assessment or session or visit service. And then section 4 is related to supervisors. So we're looking at the staff or the supervisor to staff ratios, just seeing how many staff members a supervisor is overseeing. And then along with that, how many hours per week a supervisor actually spends supervising staff, because we know that they do a lot of other work outside of just supervising. Some of them even provide direct care themselves. So we're just trying to get an understanding of how much time is actually spent supervising their staff as opposed to other stuff. And then section 5 here, kind of talked on this at the beginning. If on the provider information tab, if you are able to break out service-specific transportation-related questions, these will become unshaded and you'll be able to fill them out for each of the different services. But if you are not able to provide service-specific transportation-related information, you will fill out that transportation tab and aggregate across all of your services. So that's it for the therapy services delivery tab. Do we have any questions on this one?
We have one just about somebody not seeing those tabs, or a couple people not seeing those tabs. So you should be able to see them once you select yes about the services that you provide. So Chris, can you show again how those tabs show up based on the selection of services offered?
Yep, so this is on that provider information tab A. So question 20, are you able to provide service-specific transportation information? If you are, you'll toggle this to yes. And then if you go over to the therapy service delivery tab, you can see that this allows a toggle to be used. So if you provide services outside the office or in the community, so basically asking, do you have any travel-related information to add to the service? You would toggle this then to yes, and then you'd be able to fill out each of these sections.
And then could you also show how people get tabs F through, can't remember what letter, to show up as well?
Yep, so that is this tab here, the C programs and services tab. So when you initially open up this tab, all of these will have a dash through them in the yellow shaded areas. So for any of the services that you provide under each of these groupings, you'll go through and toggle whether you provide any of these services listed or if you don't. So if you provide any therapy services, you would toggle this to yes. And you can see tabs F and G show up. And then any of those other service delivery specific tabs will show up once you toggle these to yes. So as I mentioned,
as another reminder, when you open the document, you'll have to click enable macros at the top. So in order to get that to work. So if that's not working for you, you might want to exit out and then reopen it, click enable macros at the top, and then try again. If that's not working for you, feel free to shoot us an email and we can set up some time, share screens and work it out together.
Yeah, that's a good call out.
And that's it for questions in the chat.
Awesome. I'm not going to spend too much time on the screening, assessments, testing, and evaluation services, so these green tabs here, because the first two tabs for these services are pretty much the same as the therapy. So you'll go through and indicate which staff type are doing the specific services. And then those service delivery questions are pretty much the exact same, or they are the exact same as the therapy services. So we don't need to spend too much time going over them, but just going over the billable versus non-billable time, the staffing patterns, session service patterns, those supervisor questions, and then any transportation related questions. So same exact questions that you see on the therapy service delivery tab are on the screening, assessments, and test and evaluation service delivery tab, but they're just specific for those screening, assessment, testing, and evaluation services. And that is the same case with the autism services too. These two tabs are the exact same as the therapy as well as the screening and service delivery. The only difference is we're asking information for those autism services specifically. Moving on to crisis. Like I mentioned, every one of these groups have the same services tab where you'll identify the occupation that's actually doing the service. But then moving on to mobile crisis now. This tab is a little bit different than some of the other service delivery tabs that we've seen. So looking at this top section here, we're asking on average, how many calls does your mobile crisis team respond to in a day? In the last 12 months, how many calls did your team respond to? And then question 3, we know that there are some calls that you guys are not able to bill. So this question kind of gets at that. How many calls could you not bill for in the last 12 months? And to note, this is for MOCR services as well as mobile crisis. And then under section 2, we have staffing activities. So we're trying to understand your team structure and how your teams are kind of structured for these MOCR, mobile crisis services. We're looking for how many full-time employees and FTEs you had for those specific occupations that are delivering the services. Question 6 here kind of gets at if your team is able to do other services while not responding to mobile crisis calls. So this is just a toggle. You'll toggle yes or no. Question 7 is, are you providing care coordination as part of this service? And then question 8 goes along with that. Question 7, if yes, on average, how long does your staff spend on care coordination activities per mobile crisis event? So once you toggle this to yes, this will unshade for you to fill out. Then section 3 here, what is the average length of response time once your team arrives on site? This will be provided in minutes. Question 4 gets at equipment and supply related costs and information. So just total cost of capital equipment purchased to perform services, the average life in years of the equipment purchased, and then the actual equipment should be specified in these lines here. Same thing with supplies, just the total costs, and then the summary of the supplies and put into the specified boxes here. And then section 5 is really the transportation, just asking about mileage and length of time spent driving, an average number of plane flights and cost of a plane flight if you're actually flying out to deliver any of these services. And then question 6, we noticed that the mobile crisis follow-up is an additional service, but we're trying to answer those questions here within this mobile crisis tab itself. So we're trying to understand who is the staff type that actually provides the follow-up. Is the service delivered in person? If it is delivered in person, what is the average mileage driven to provide that service? And then the same thing along with that, if it is delivered in person, what is the average, like the time spent driving to provide the service? So that's it for mobile crisis. There's some similar questions that we've seen on the other service delivery tabs, but it's just shaped a little bit more to kind of get more into the weeds on the mobile crisis services themselves. So I'll move on to the short-term crisis tab. This one has pretty much the same questions that we've seen within the therapy service delivery tab, getting at the billable versus non-billable time, the staffing patterns, so seeing how many participants is one practitioner seeing in a single point of time, the session service patterns, so seeing how long in hours it takes to actually do a service, Section 4 is for the supervisor related questions, just on average, how many staff members is one supervisor supervising, and then how much or how many hours per week is a supervisor spending on supervising staff. And then section 5 is just those transportation related questions again. So 23-hour and then crisis residential do look a little bit different, since those services are kind of structured differently than our typical therapy services. So this tab is a little bit different than the therapy service delivery tabs that we've seen prior. So we still do have the billable versus non-billable time section at the top here. In section 1, we're looking to gather time spent on client-facing services versus stuff outside of client-facing. And then down below here in section 2, we're trying to get at the staffing patterns. So just a typical staffing team structure. So just looking at what type of team members actually deliver the services and then what the ratio is. So in our example here, we have like a registered nurse, be one registered nurse for 4 participants. A behavioral health specialist / technician would be one of those for every 8 participant. So that's just kind of the information that we're trying to gather here. And then if there's any variation between day and night, they'll toggle this to yes or no. And if there is any variation between providing services during the day versus night, you'll describe those differences here in the specified box. And then same thing here with 14 through 16, we're trying to see if there's any variation between providing services during the weekday versus the weekend as far as staffing and as far as like those ratios. So if there is any variation, please just indicate those in these questions here. So section 3 is home and service characteristics. So just trying to get a sense of where the center is located, the average number of total beds operated by your organization, and the average number of empty beds per day. Question 4 is just same thing, session service patterns, just trying to get at how long on average it takes to actually deliver a service. Section 5 are those supervisor questions. Section 6 are the equipment and supplies related questions, just cost, average life in years, and then just describing what the actual equipment and supplies is. And then transportation is down here in section 7. So the key difference here is really those staffing pattern questions, just trying to understand the variations between day and night, if there are any, and then also during the week versus the weekend. But if there isn't any variation, you'll just provide just this question 11 here. Looking at crisis residential services. Section 1 are the home and service characteristics, so understanding where the center is located. Same thing to the 23-hour crisis, trying to get the total average number of beds and empty beds. The equipment and supplies related questions again. And then similar thing here, just looking at the different staffing patterns, seeing if there's any variation between day and night. And then see if there's any variation between the week versus the weekend as far as staffing and staffing ratios between participants and staff member. And section 4 is just a question related to supervisors again. Section 5, we're just trying to get the number of training hours for these staff members. So question 16 looks at the number of training hours received by staff in their first year of employment. And then 17 is number of training hours received annually by staff after their first year of employment. And then we have client transportation. So it's transportation questions related to clients specifically. And then in section 7, we have staff transportation. So this would be any staff related transportation questions. So that's it for the crisis services. Were there any questions on any of those?
Nothing in the chat.
Awesome. We move on to alcohol and drug services. So looking at their service delivery tab, pretty similar questions up top here. But looking at the staffing patterns, we notice that in some of the services that we have bucketed as alcohol and drug services, there are adolescent and adult services. And we want to see if there's any variation between staffing patterns between adult versus adolescent services. So that is marked down here. So if you do offer adult or adolescent services, or even both, you will toggle that here. So if you just offer adult services, you'll toggle that, fill out the staffing ratio for adult. Same thing with adolescents. But if you provide both adult and adolescent services, you'll fill out those staffing ratios for both of those here. And then following that, we're just trying to understand the staff types required to deliver each of these services. And then for any services that require daily therapy, on average, how many hours of therapy are provided daily to each participant? So just trying to understand the hours of the daily therapy, if it is provided for these services. And then a lot of these other questions down here are just similar to what we've seen on other tabs, as far as the session service patterns, supervisor questions, and then questions related to transportation. So the key difference here is it's really just focusing on the adolescent versus adult splits for some of these services. I will skip over the category they have as other services, as this is structured similar to some of the other service delivery tabs that we've seen. But then I'll go into the day treatment services. So the way that this service delivery tab is structured is we look at the first section here, which is service characteristics, so number of individuals receiving day services from your organization. So it's the total number of individuals for each of these services. Trying to understand here in question 2 where the services are offered, whether it's individually or in a group setting. Question 3 is understanding the site for delivering the services, whether it's out in the community or in a facility or both. And then question 4 is for the average number of zero occupancy days per year. Section 2, pretty similar to what we've seen before, is surround equipment and supplies. Section 3 here, just trying to understand your staffing and your team structure, and how many team members it takes to actually deliver this service. And then if there's any case management for your service, just how many hours of case management, if applicable, are provided for this service. Section 4 is for productivity, so still just getting at that billable versus non-billable time. Section 5 is related to supervisor span of control. Section 6 are the staffing patterns. So same thing here. There are some services that we notice are adolescent and adult. So we're trying to see if there's any variation between staffing patterns between the adult versus adolescent services. And section 7 is staff training. So it's the number of hours received by staff in their first year of employment, and then annually for their first year after their first year of employment. And then just client transportation and staff transportation. Then moving on to residential services now. There's some similar questions to what we see on the day treatment service delivery questions, but there's a few different ones. So this top section here, we're trying to understand the number of residencies or homes operated by your organization, the number of residential coordinators employed by your organization, and then how many homes on average is a coordinator responsible for. We're also asked the average number of clients per home and the average number of beds per home, as well as absence days and number of empty beds. And a lot of this other stuff we've seen before around equipment, staffing, just trying to understand the team structure, supervisor related information, staffing patterns. There's one service that we have noted up here that's adult and adolescent. So again, just trying to see if there's any variation between adult and adolescent services as far as staffing ratios. And then we also want to see if there's any variation between services provided during the day versus the night as well for these residential services. So that's all done here in section 5. And then section 6 is just related to staff training again, and then 7 and 8 are related to the client staff transportation. So the final service tab is the case management tab. So we have case management, intensive case management services, and then substance use disorder care coordination is also added in here as well. Top section is trying to understand the distribution of time between client facing and doing other things outside of client facing time. Second section here is around just transportation and the total miles driven per week between client residences. Next section is around supervisor staffing. And then the section here is related to participants. So just looking at how many participants does your organization currently serve for these case management and care coordination services. And I'm looking at what the average caseload is per case manager for these services. And also what type of staff are providing these case management services, whether it be a case manager, a nurse, or a licensed clinical social worker. We're trying to just understand who's providing these case management services. And then looking at the total caseload up here, we're trying to understand approximately on average how many hours per month do each of these caseloads require. So this is between 0 and 3, 4 and 6, 7 and 9 hours, and then over 10 hours per month. And then we ask if any services require more than 6 hours per month to check any of the boxes that apply to why it is a factor of having case management services over 6 hours per month. So whether it be crisis management or if there's a difficult participant behavior that's causing them to just have more case management hours than 6 hours a month, you would mark that here. Now we kind of got into this tab before, but this is the last tab in the survey. First question, just asking how long and the amount of hours it take for you to complete this survey. So just trying to understand how long it took for every single one of you to complete this. And then as we mentioned, there's an additional information section. So if there's any information or any clarity that you want to provide that you weren't able to fill out in certain sections of the survey, definitely feel free to add this in here. I think it's super valuable to add in any information that you can that we aren't capturing potentially within the survey itself in this section. But that is it for walking through the survey. Are there any additional questions at the moment before we kind of walk through the next slide and then have some time for questions?
Nothing else in the chat.
Awesome. I'll switch back to the deck. All right, so just some things to highlight again about the survey itself. The survey is Excel based, so we would appreciate you guys sending it back to us in Excel format. Sometimes we get them back in a PDF format, but it's easier for us to do some of our analysis. We just collect it back as an Excel file, and to also double check to make sure that you've enabled content to allow those macros for you to toggle whether you provide services for those service delivery specific tabs that show up. We just definitely recommend and strongly encourage every single one of you to fill out the survey. It's super vital and critical to the rate study process. We can't thank you guys enough for taking the time to meet with us today to learn more about the survey itself and then actually taking the time to fill it out. So some helpful tips there on the right are to start early because there might be some questions that come along that you can definitely send to us and we will respond within 1 day. Make sure you save frequently and complete all tabs in the workbook.
And just on the note of macros, sorry, it seems like there's a couple people writing in the chat about functionality issues, but please feel free to email us. We'd love to work it out with you and see what we can do. So definitely email us and we'll set up some time individually if it doesn't seem to be working for you.
Yeah, we could potentially just send a file over to you if you aren't able to toggle due to the macros, so we can just open the tabs for you and shoot you that version of the Excel file over. That might be easier too. With some next steps, so on the left-hand side is what we went through today, the initial provider training, just walking through the survey. As we mentioned throughout the meeting today, following this training, we're here through this Alaska rate study _BH@guidehouse.com for you to ask any questions. As we mentioned, we'll respond within 1 business day. And if there's any additional assistance that you all need, If we need to set up additional calls to kind of walk through things, we can definitely do that. But we're here as a resource and to answer any of the questions that you all have. So looking at the survey timeline now, we released a survey to you all this past Monday, September 16th. Today we walked through in depth the survey, and then between now and October 15th, you all have the time to fill out the survey and ask questions, and then the final surveys are submitted to us by October 15th. So as I mentioned, final surveys are due to that Guidehouse email, the AK_ratestudy_BH@guidehouse.com by October 15th. And just two things to note too, we strongly encourage and recommend you all to include your agency name in the subject line of the email when you send your surveys back into us. And then if you could also please add your agency name to the end of the actual file name itself, that would be greatly appreciated and help keep things a little bit more organized. But I believe that is it on our end. Looks like we have about 5 minutes left for some questions if you all have any. If not, then thank you all so much for meeting with us today and going over the survey. Really appreciate it.
We do have one question in the chat around the due date, knowing that it's the middle of financial audit season. So is there any flexibility in the deadline? So we can be a little flexible. I would say email us if you have an extenuating circumstance. We are really trying to work with you all, but also want to make sure that we can get the rates to you in a timely manner as well. So, and obviously we will need the survey results in order to do that. So we can be a tiny bit flexible, knowing that, this is a big ask, and filling out the survey takes time. So definitely feel free to email us and we'll get back to you. And like Chris said, thank you all so much for joining and participating. Again, I know this survey is quite bulky and we really appreciate the time spent both here this afternoon and filling out the survey as well. So we'll stay on for the last 4 minutes, but again, feel free to raise your hand or put more questions in the chat. We really appreciate your time. I'm steadily seeing people fall off. So feel free, like we said, to email us with questions if you have any. But otherwise, thank you so much for your time.